The 4 wavelengths of K-laser and their application. Wavelengths are absorbed by chromophores and at different levels of depth in the body. The chromophore cytochrome C oxydase is present in almost every cell in mitochondria. This chromophore is responsible for photobiomodulation with increase of ATP production. This chromophore has a maximum effect plateau between 790 and 900 nanometers. The water chromophore also is present everywhere in the body. Haemoglobine and oxyhemoglobine is present in every blood vessel and capillaries. Melanin pigment is only located in the skin cells, so it is useful only for superficial injuries. The 660 nanometer wavelength is part of the visible red light spectrum. It is used to visualize the laser beam. The 660 nanometers is highly absorbed by melanin. It is also absorbed by cytochrome C oxydase, not as much as the 800 nanometers wavelength, but efficient still. In the near-infrared spectrum, melanin depth of penetration remains very superficial, 1/4 to 3/4 of a millimeter. So it means that the 660 nanometers is a wavelength with really good results for skin superficial injuries, such as wounds, bruises, burns, hematoma, diabetic ulcers, bed sores, and others. The 800 nanometers wavelength targets some melanin as well, but the main target is the cytochrome C oxydase. This wavelength is in the optical bracket for maximal effect of photobiomodulation. It can reach superficial and deep tissues. The 800 nanometers wavelength brings analgesic effect on nerve and anti-inflammatory effect, so it is great for pain management, such as osteoarthritis, chronic back pain, neck pain, frozen shoulder, whiplash injury, hernial disc, plantar fasciitis, cruciate injuries, and many others. This wavelength creates the perfect healing environment, boosting ATP production of the cells, growth factors, and local vasodilation, improving blood supply to the injured site. It is a great asset in sport medicine too, in musculoskeletal rehabilitation, tendonitis, nerve injury, and muscle performance during sport events and trainings. The 970 nanometers wavelength mainly targets water and some melanin and hemoglobin also. This wavelength is too far from the interval of the maximum absorption of cytochrome C oxydase to trigger any effect from it. However, the absorption by water brings micro-local gradient of temperature and micro-vasodilation that increases blood supply and drainage of metabolic waste, such as lactic acid. Therefore, this wavelength is quite useful as an additional benefit in sport to optimize muscle performance during the activity and decrease the recovery period post-exercise. The increase of blood supply also helps with tissue healing. The 905 nanometers wavelength targets mainly hemoglobin and cytochrome C oxydase, and some melanin and water too. This wavelength is just at the limit of the interval of the maximum effect for cytochrome, and it does not penetrate as deep as the 800 nanometers in the tissue. But there is still some effect. So again, application are tissue healing, cell performance, and pain relief. The effect from hemoglobin is the improvement of the exchange of oxygen and CO2 in the tissue. These effects are still additional benefit to add to the other wavelengths and are not to neglect. Application for these wavelengths come from a better tissue oxygenation and will help to accelerate tissue healing and optimize sport performance. It means that the 800 nanometers wavelength is essential for photobiomodulation for deep tissue and musculoskeletal applications. But the other wavelengths are also useful for complementary effect to improve blood supply, facilitate oxygen exchange in the tissue, and drain the metabolite waste. Together, it brings the ideal environment for pain management, tissue healing for rehabilitation, and optimal muscle performance during training and sport events.